On this video, we're going to look at breastfeeding and the keys to success. Breastfeeding is a huge topic, so we're going to break it down into a few different videos. So the most important element for successful breastfeeding is getting the positioning and attachment of your baby correct at the breast. So I want you to do a little exercise for me. With your tongue, feel the roof of your mouth, feel where the hard palate is, and then take your tongue back to the rear of your mouth and feel the soft area, the soft palate there. So it may surprise you to learn that the soft palate is the part of the baby's mouth where the nipple needs to be. So the baby needs to have a really good mouthful of breast in its mouth. It's not called breastfeeding rather than nipple feeding for nothing, because the baby is milking the breast rather than sucking on the nipple. And if the breast is well positioned, then it's much less likely that mum will become sore, and it's also much more likely that the baby will get a good supply of milk. The next thing to consider is the way that the baby is lying as you bring them onto your body. So very often babies are held across the body in what's known as a cradle hold, and in this situation we want the spine and the neck to be all aligned, the head and the spine, so that it's coming on straight. If your baby is lying facing up at you and having to turn its head to get to the breast, it's much harder for it to swallow, just as if you're looking over your shoulder to swallow, it's much more uncomfortable. So making sure the spine and the head are in alignment, and if possible wrapping your baby's legs around the side of your body to keep them nicely tucked in will help with that spinal alignment. The next thing we need to think about is the baby's chin, and we want the baby to lead with the chin as it comes onto the breast, so that that opens up its throat and allows it to swallow more easily. So to enable it to do that, it's really important that you don't have your hand on the back of their head pushing their head down onto the breast, because that makes it much harder for your baby to swallow the milk. When they're approaching the breast, we want to see that their mouth is wide open and their tongue is slightly sticking out over their bottom lip, and that then helps them to take a good mouthful and also to make a good attachment around the base of the breast, so that the air doesn't get in, so there's a good suction created. And finally, whilst you're watching your baby, you want to see that they are sucking, swallowing, and then pausing. So the pauses that occur within the rhythm are all part of it, very important. It doesn't mean that they've finished just because they're not sucking all the time. You'll be able to tell eventually when they finish, because they'll come off the breast, but if they stay on, they're just in the middle of their cycle, and we'll come back to the sucking and swallowing in a moment. And you should be able to see their jaw moving as they move up and down in order to milk the breast, to enable the milk out. The other thing to be aware of is the way that the supply and demand element of breastfeeding works. The more you feed your baby, the more milk you will make. And the frequency of the feeds will really encourage her body to keep making milk. So most new babies in the first 6 to 8 weeks, which is about how long it takes to get breastfeeding really well established, most babies in that time will require feeding about every 2 to 3 hours, very frequently. Some feeds won't take long, some will take longer. But if your baby is feeding that often and you're letting them feed for as long as they need to at each feed, it will be boosting your milk production, and also it will be helping your baby, because they only have a small tummy, they're only taking small amounts to begin with, and the milk is easily digested, so they become hungry again quickly.